Hello and welcome to a brand new episode of LP60. This week we are putting the focus, the spotlight on a disease that many people are not talking about. We're talking about cervical cancer. It's the second most frequent cancer that affects women in India. It's a disease that is in fact completely preventable, and that's the problem. In spite of the fact that there is a vaccine available for cervical cancer for 17 long years, including an indigenous one, there are very few takers for it. The fact of the matter is that there is little awareness. Worse, there is stigma attached to cervical cancer because of the sexual nature of this disease. It is a sexually transmitted disease. 88% working women in India have not taken the vaccine against cervical cancer. And that's the reason why this show is going to put the focus on the disease. We're going to be busting the myths around cervical cancer. We'll tell you all about the vaccine, who should be taking it, and tell you all about the information that you must know to beat cervical cancer. Take a look at these numbers first, the staggering numbers. This gives you an idea about the gravity of the situation, about how big this problem really is. I'm Sneha Mordani. This is LP60. Let's begin by telling you all about cervical cancer. What exactly is cervical cancer? What virus causes it? What exactly is HPV? And what happens when the virus enters your body and begins to thrive in it? Cervical cancer or cancer of the cervix. Human papilloma virus, commonly known as HPV, is the most prevalent sexually transmitted infection globally. Cervical cancer is a growth of cells that starts in the cervix. The cervix is actually the lower part of the uterus that connects to the vagina. HPV is a group of more than 200 related viruses, with certain types posing significant health risks, including the development of cervical cancer. According to the World Health Organization, cervical cancer is the fourth most common cancer in women across the globe. But our focus and awareness is mostly around breast cancer, which of course is common, but not so much about cervical cancer. HPV can affect the skin, the genital area and throat. In most cases, the immune system clears HPV from the body, but persistent infection can cause abnormal cells to develop in the body, which can become cancerous then. What then is HPV? HPV is actually a virus that can be transmitted through intimate skin-to-skin contact, including vaginal, anal or oral sex with someone who has this infection. HPV can often, in fact, be harmless. It is so common that nearly all sexually active individuals will contract it at some point in their lives, according to the WHO. While many types of HPV are harmless and do not cause any symptoms, others can lead to health problems such as genital warts and various forms of cancer. So how does HPV cause cervical cancer? The link between HPV and cervical cancer is particularly strong. High-risk types of HPV, especially HPV 16 and 18, are responsible for the majority of HPV-related cancers. These high-risk HPVs can cause changes in the epithelial cells of the cervix, leading to dysplasia, which is an abnormal growth of these cells. This can range from mild to high grade, with the latter having a greater potential to develop into cancer. While HPV infection leads to the development of cervical cancer, other factors such as smoking, having a weakened immune system, and long-term use of oral contraceptives can increase the risk. Are you at particular risk of developing cervical cancer? Have you inadvertently increased your risk factors? What has poor lifestyle, smoking got to do with cervical cancer? What about having multiple sexual partners? This report is going to tell you all about the risk factors for cervical cancer.
Infection with HPV is common, and in most people, the body can clear the infection by itself. Sometimes, however, the infection does not go away and becomes chronic. Chronic infection, especially when it is caused by certain high-risk HPV types, can eventually cause certain cancers, such as cervical cancer. A risk factor is anything that increases your chance of getting a disease such as cancer. What are the risk factors for cervical cancer then? Sexual history. Several factors related to your sexual history can increase the risk of cervical cancer. The risk is most likely affected by increasing the chances of exposure to HPV. Becoming sexually active at a young age, especially younger than 18 years old, having many sexual partners, having one partner who is considered high risk, someone with HPV infection, or who has many sexual partners.
Sexual activity starting at an early age, at a younger age, less than 18 years of age, having multiple sexual partners and having multiple childbirth does cause an infection with the HPV virus which eventually can lead to the persistent infection of the cervical canal and the cervix with the human papilloma virus. And in some patients, some people can lead to the changes in the cervical epithelium, which can eventually progress into the cancer.
Smoking. When someone smokes, they and those around them are exposed to many cancer-causing chemicals that affect organs other than the lungs. These harmful substances are absorbed through the lungs and carried in the bloodstream throughout the body. Women who smoke are about twice as likely as those who don't smoke. Having a weakened immune system, human immunodeficiency virus (HIV), the virus that causes AIDS, weakens the immune system and puts people at high risk for HPV infections. The immune system is important in destroying cancer cells and slowing their growth and spread. In women, the HIV, a cervical precancer, might develop into an invasive cancer faster than it normally would.
The disease doesn't affect the immune system per se. HPV is not like HIV. But patients who have HIV also, of course, these are the patients who would have been sexually active most of the time, not necessarily, though there are patients who can get HIV through blood transfusions and needle break injuries, etc. But if a patient has HIV, your immunity goes down, and that is how the HPV can become more sinister for you. So it is also a play of how your body immune system reacts to HPV. If you have a very robust, strong immune system, it is quite possible through your own immune system, you'll be able to shed off the HPV virus and not get the HPV related cancers or HPV related issues. But if you are weak on immunity, then the HPV can become better of you and can go into develop cancer.
Chlamydia infection. Chlamydia is a relatively common kind of bacteria that can infect the reproductive system. It is spread by sexual contact. Women who are infected with chlamydia often have no symptoms and they may not know that they are infected at all unless they are tested during a pelvic exam. Chlamydia infection can cause pelvic inflammation leading to infertility. Some studies have seen a higher risk of cervical cancer in women whose blood test and cervical mucus showed evidence of past and current chlamydia infection. Long-term use of oral contraceptives, birth control pills. There is evidence that taking oral contraceptives (OCs) for a long time increases the risk of cancers of the cervix. Having multiple full-term pregnancies. Women who have had 3 or more full-term pregnancies have an increased risk of developing cervical cancer. It is thought that this is probably due to the increased exposure to HPV infection with sexual activity. Also, studies have pointed to hormonal changes during pregnancy as possibly making women more susceptible to HPV infection or cancer growth. Economic status. Many low-income women do not have easy access to adequate healthcare services, including cervical cancer screening with Pap tests and HPV tests. This means they may not get screened or treated for cervical precancers. In New Delhi with Sneha Mordani, Bureau Report, India Today.
What then are the signs and symptoms of cervical cancer? Should bleeding in between periods be seen as a red flag? Should you consult a doctor? We're telling you about the signs and symptoms of this disease. Let's now tell you about the symptoms of cervical cancer. Important to know that many patients of cervical cancer, especially in the first stages, may not see any symptoms. During the advanced stages, some of these symptoms can appear. Vaginal bleeding in between periods. Vaginal bleeding during sexual intercourse or after sexual intercourse. Vaginal bleeding sometimes even after menopause. Discharge from the vagina having a small odor. Sometimes the discharge may also have blood spots. How difficult is the fight against cervical cancer? What is the ordeal that patients go through? We're telling you more about this through the eyes of a survivor against cervical cancer. She's telling us all about her ordeal. Also in this report, the screening which is imperative to detect cervical cancer. We're telling you all about the tests as well, which are so important for prevention.
Cervical cancer is the second most common cancer in India, making up for about 18% of all cancers. Cervical cancer is so pervasive in India that the number of cases in our country make up for the largest proportion of the global cervical cancer burden. 46-year-old Sheetal suffered from cervical cancer. Sheetal hails from Chandigarh. Having worked in Mumbai for almost 2 decades, she now dedicates her time to being a homemaker. Sheetal spoke to us about her sobering experience. But even after finding out that she has cancer, Sheetal, though unnerved at the beginning, remained headstrong due to her family history. Sheetal's mother too had cancer.
This was somewhere in mid-September last year, in 2023, that I had an episode of unexplained bleeding. The date did not coincide with my period date, so I was a little conscious. At first I was slightly in a denial mode, but then given the history of my family, since my mother is also a cancer patient, so I approached a gynecologist nearby, who then raised doubts about something being wrong. So then after that there were a lot of tests. I did my pap smear, I did my ultrasound and all, and after the biopsy it was diagnosed that I have cervical cancer.
Sheetal considers herself lucky that her cancer was caught early.
Actually, things didn't take much long because of my mother. Our ecosystem was already set. We knew where to go, we knew which doctor to follow, and then finally we decided that I'll have to go in for a radical hysterectomy, which means that cervix and the ovaries and the uterus, everything was removed. Because the cancer that I had, it's called the squamous cell carcinoma. It was, I was lucky enough that it got detected at a very early stage. So it was at stage 1. So immediate surgery was done.
But Sheetal's story is one of resilience, where she avidly advocates early screening tests and regular checkups.
My advice to young ladies out there would be that don't neglect your health. Don't neglect your health at all. We being ladies, we keep our family, our husbands, our children, but we have to take care of ourselves. So I would say be selfish and be very regular with your checkups. Be very regular, especially after your 40s. Be very regular. I think pap smear and all should be done once in 3 years, definitely. And for young girls, as soon as they hit puberty, they should get their the cervical cancer vaccination done.
While there is a collective effort to eliminate cervical cancer, a lot needs to be demystified about preventive measures and vaccines. Experts suggest that early detection and screening can make a significant difference in preventive outcomes and better treatments. The two most essential screening tests are the Pap test or Pap smear test and the HPV test. The Pap test involves taking a swab of your cervix, after which the cells are observed under the microscope. This test can detect both cancer and precancer. If the test is precancerous, the cancer can be prevented. But if it is cancerous, it is curable if detected in the first or second stage. This is why early detection and testing is key. Routine screening, ideally every 3 years in women aged between 21 and 65 years, can help prevent cervical cancer. The other essential test is the HPV test. It's a DNA test that detects human papilloma virus or HPV. The test is conducted between the ages of 30 to 65 years every 5 years, in combination with a Pap test. The test doesn't tell you whether or not you have cancer, but can help you detect HPV, which increases the risk of developing cervical cancer.
If you have not contracted HPV and your HPV test is negative, then your chance of a future cancer is also negative. So HPV test, in addition to the Pap test is to catch only the presence of cancer. उसमें तो you will only find cancer cells are there or not. But HPV test will also tell you about your risk of having a cervical cancer in the future. So the ideal time to start is once the female is sexually mature, right? If you go by the strict guidelines, it is 31 years from the start of 31 years. And you start doing an you'd start doing a Pap test, which is only a cytology test, not an HPV test, once in 3 years, assuming that the female has become sexually active by that time. Otherwise, starting from, if the female is sexually active, you can start earlier also. A simple Pap test, which is a cytology test, not an HPV test, is to be done once in 3 years. If you are doing an HPV test, then you are gauging the risk also in the future. Then you can do it once in 5 years also.
So what is HPV? 14 types of HPV have the potential to cause cancer, but HPV types 16 and 18 are high-risk strains. They are responsible for over 70% of all cervical cancer cases globally. About 5% of women in India are estimated to harbor HPV type 16 or 18. Unfortunately, poor awareness, stigma due to sexual transmission of HPV, and a delay in the government rollout of the vaccine are major reasons behind the rise in cervical cancer cases. Fewer than 1 in 10 women in India have been screened for cervical cancer in the last 5 years, according to the World Health Organization. With Chetna Vasudevan and Sarthak Sharma in New Delhi, Sneha Mordani for India Today TV.
There is just so much misinformation around cervical cancer. There is lack of awareness and there are just so many myths that one needs to bust. And that's the reason why our next report is going to be telling you the myths of cervical cancer and the facts around it. Take a look. Let's now bust some myths around cervical cancer. First of all, cervical cancer is hereditary. That is a myth. It isn't hereditary at all. It is caused by a virus that infects an individual and isn't something that gets passed on through the generations. Patients of cervical cancer cannot become pregnant. That again is false. Patients suffering from cervical cancer can recover during the course of the treatment, can let their ovaries be set aside during radiation, and once they are out of the situation, they can conceive. There are several fertility treatments available for them. Another myth associated with cervical cancer is that you need to get an HPV and a Pap smear test year after year. That isn't correct. Once in 3 years is good enough once you are clear. Also, there is a myth that multiple partners, people who have multiple sexual partners, are the only ones getting cervical cancer. Well, that definitely increases your risk. However, many people with single partners also get cervical cancer. There is little conversation around cervical cancer, but did you know that unlike many other cancers, this can be prevented? More than 95% of all cervical cancer cases are linked to persistent infection with certain high-risk strains of the human papillomavirus or HPV. That's why vaccination is being done on a war footing in a country like India that accounts for nearly 1/5 of cervical cancers globally. India reports around 1.25 lakh cases and about 75,000 deaths each year. The vaccine is 97% effective in preventing cervical cancer. Well, a new study has found that the number of cases of cervical cancer have been detected in young women who have been fully vaccinated as part of the HPV immunization program. So who needs to get the vaccine? HPV vaccination is recommended for children between the ages of 11 to 12. It is also recommended for girls and women above the age of 13 to 26 years of age who have not yet been vaccinated or completed the vaccine series. Can pregnant women get the vaccine then? The vaccine is not recommended for pregnant women. Studies show that the HPV vaccine does not cause problems for babies born to women who are vaccinated while pregnant. A pregnant woman should not get any doses of the HPV vaccine until her pregnancy is completed. Why is HPV vaccination only recommended for women through age 26 then? HPV vaccination is not recommended for everyone older than 26 years of age. Some adults above the age of 27 or through 46 years who were not already vaccinated might choose to get HPV vaccine after speaking with their doctor about their risk for new HPV infections and possible benefits of vaccination for them. Can men get cervical cancer as well? Well, some forms of the virus are capable of causing cancer in both men and women. While cervical cancer in women has historically been the most common form of HPV-related cancer, CDC data shows that roughly 4 of every 10 cases of HPV-induced cancer now occur in men. The burden of high-risk HPV infection is estimated to affect 1 in every 5 men over the age of 15 years. The HPV vaccine has become an essential part of basic preventive health care for preteens, teenagers and young adults. It prevents against 9 strains of HPV, a virus that can be transmitted through sexual contact of all types, including vaginal, oral and anal sex. HPV can cause genital warts and in some people, cervical, throat, anal or other cancers. Countries like the Maldives, Myanmar, Sri Lanka, Thailand even have robust immunization programs against cervical cancer. India is yet to make it a part of the national immunization program in spite of strong recommendations that it must be started. Children, young girls as old as 9 can get the vaccine against cervical cancer to prevent this infection. The vaccine has an efficacy rate of about 97%, which is simply fantastic. So why aren't we doing it? It's a huge question mark on why we are not vaccinating our population against cervical cancer. Well, that brings us to the end of this edition of Health 360. We hope you enjoyed watching the show as much as we did, putting it together for you. You can find the story and much more up on our website too, that's indiatoday.in. You can also download the app. Also, find these reports around health and wellness on India Today's social media platforms, which is YouTube, Instagram, Facebook and Twitter. Until next time, stay safe. Thank you so much for watching.